Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning, Melvin, and good morning to Switzerland.
Good morning, Professor Schmidt, and good morning, good afternoon, or good evening to those who are watching us or listening to us today.
The topics we're covering today are monkeypox spiking in 10 African nations. Melvin will present to you an increased hypervirulent multidrug-resistant Klebsiella pneumonia strain. He will also talk about the risk of heart attack and stroke, and that this dropped after COVID-19 vaccination in the United Kingdom. I will give you an H5N1 update from the American Centers for Disease Control, and I will cover two articles from today's New England Journal of Medicine on politicians' refusal for preparedness for an influenza pandemic and on post-acute sequelae of COVID, PASC, comparing vaccinated versus unvaccinated subjects. With that, Melvin, let's start with monkeypox in 10 African nations.
Yes. So here I will cover a report released a few weeks ago by the African Center for Disease Control and Prevention, the Africa CDC, about monkeypox cases or mpox cases that have risen by 160% on the continent this year compared with 2023. So while 96% of cases have been recorded in the Democratic Republic of Congo, or DRC, several other African countries have also reported new outbreaks, including Kenya, Cote d'Ivoire, and the Central African Republic. As of July 2024, a total of 14,250 cases, almost 3,000 of them have been confirmed, 11,000 suspected, and 456 deaths, so the case fatality rate is around 3.2%, have been reported in 10 African nations, including Burundi, Cameroon, Central African Republic, Congo, DR Congo, Ghana, Liberia, Nigeria, Rwanda, and South Africa. And although safe and effective mpox vaccines and antivirals were widely available in the United States and in Europe, their use is really uncommon in Africa. And the report also mentions that clade 1b is spreading in DRC. Some of the cases have been caused by what researchers are calling this clade 1b. It's a new mpox lineage identified in the DRC last year that is highly transmissible and has a higher case fatality rate than clade 2, which swept across the globe in 2022 among men who have sex with men in sexual transmission pattern. This case fatality rate for clade 2 is less than 1%, while 1B's case fatality rate is roughly 6%. And there is evidence in the DRC that clade 1B is spreading both through household transmission and sexual transmission, with clade 1B and clade 2 outbreaks occurring simultaneously. So this could be the reason why we are seeing all these outbreaks, because it's really the different clades of mpox, 1B and 2, simultaneously spreading.
Melvin, that is devastating news. The question is, why is this and why does it appear all of a sudden? Were cases not reported, or was it a hidden epidemic, or any information what is going on, what was going on?
Well, one is that these two clades spreading simultaneously, also because it's, as we know, spread from person to person, right, through direct contact with infectious sores, bodily fluids, and respiratory droplets. Of course, if the community is not fully aware, then they will not be also aware of the prevention methods. That's one. And I guess the other is that limited healthcare infrastructure in most of these countries, where surveillance system is also not optimal. So detection and response to the outbreaks is also not optimal. And as I've mentioned, limited access to healthcare services, limited access to vaccination and antivirals could also be one of the reasons for this. And maybe there are other reasons that we have not thought about.
Yeah, the second poor or bad message here, besides the sheer numbers, is the high case fatality rate. And I remember during COVID, we were fighting the 1%, right? That was something that was really a lot, and now we are at 6% here. So this is a devastating disease. This is really different from what used to happen in Europe and the United States, if I remember correctly.
That's right. That's right.
Is there any WHO efforts to get vaccines into these countries, or is this not feasible because of money or lack of cold chain or any technical items?
There is some effort, but again, as during during the COVID pandemic, right? During the height of the COVID pandemic, it's really a lot of factors, but then access is really related to the ability of the countries to be able to afford these antivirals and vaccines, unfortunately.
Much needs to be done here. Yeah, thanks for this part, which is bad news, but thanks for bringing up. And you have a second bad news, I should say, which is antimicrobial resistance with Klebsiella pneumoniae.
Yes, so the WHO is warning countries about increasing reports of hypervirulent and multidrug-resistant Klebsiella pneumonia, or HVKP. The warning is actually based on a global assessment the WHO conducted through its Global Antimicrobial Resistance and Surveillance System, also known as the GLASS. Um, it issued a request for information earlier this year to all countries enrolled in the system after receiving reports of increased identification of this hypervirulent multi-drug resistant Klebsiella pneumonia isolates in several countries. Of the 43 countries and territories that responded to the WHO, 16 reported the presence of the HVKP strains. In contrast to classic Klebsiella pneumonia, an opportunistic pathogen that is a leading cause of healthcare associated infection and tends to cause infections in vulnerable, immunocompromised, hospitalized patients. This HVKP strains can cause severe invasive infections in healthy individuals that develop quickly and spread to different body sites. And infections caused by HVKP strains have been associated with high morbidity and mortality, although this HVKP infections were initially found community settings in parts of Asia and were susceptible to antibiotics. Recent reports have shown transmission of multi-drug resistant HVKP strains in healthcare settings in several countries. So this is the reason why the WHO is particularly concerned about this one.
I remember Klebsiella pneumonia from my clinical time as a pathogen causing pneumonia in the elderly and also causing outbreaks in intensive care units. And that's what it is still restricted to, or is there even disease in the community? I think you said also in the community, right?
That's right. That's right.
That is really something. That is really important piece of information. I don't see any manufacturer coming up with new vaccines directed at Klebsiella pneumoniae for various reasons. But does the paper cover any outlook on the future, any solutions coming up?
Not specifically on the paper, but Professor, I know that there are a few groups in the US trying to make a vaccine. This one group in the University of Maryland, and also the other one is in Tulane University. But these are just preclinical stage vaccines, and we're not sure whether they're going to even move to the clinical stage, even if they have promising preclinical data.
Yeah, the question, Klebsiella pneumonia is part of it's an enterobacteria, and it is part of the normal gut flora. So addressing that with a vaccine may be difficult, right? That may be difficult.
Yep.
Very interesting. Thank you very much for this. And lastly, you have a very interesting study on the risk of heart attack and stroke after COVID.
Yes, so this study really involved 46 million adults in England, and it showed that the incidence of both heart attacks and strokes dropped following COVID-19 vaccination compared to the incidence before or without vaccination. The study authors said that the incidence of common cardiovascular diseases dropped after every COVID-19 vaccination, but COVID-19 vaccination was also associated with slightly increased rates of myocarditis and pericarditis following mRNA-based vaccines and vaccine-induced thrombotic thrombocytopenia following adenovirus-based vaccines such as the AstraZeneca vaccine. And the study was really based on findings from the British Heart Foundation Data Science Center at Health Data Research UK, with research analyzing de-identified health records from 46 million adults in England from December 2020 to January 2022. And during that period, most of the adults were vaccinated with at least one dose of COVID-19 vaccines from Pfizer, Moderna, and AstraZeneca. And among the study participants, over 37 million people received a first vaccination and were eligible for the second dose during the study period. And this England-wide study offers patients reassurance really of the cardiovascular safety of the first, second, and booster doses of COVID-19 vaccines.
That is very good news. And we covered side effects of COVID vaccination in our previous recordings. And my question then to you would be, what is the impact? So the study population was 46 million of adults in the United Kingdom. That's probably almost the whole adult population, right? If I remember correctly, the UK has, or England has roughly 60 million inhabitants. So that would probably be all adults. So what was the impact? How many cases of stroke or heart attack were prevented?
Well, the vaccination program in general in the UK averted between 6.5 to 8 million infections and between 26,000 and 28,000 deaths in England. This is for COVID in general, and around 2,600 to 2,800 deaths that are related to stroke and heart attack. So that's around 10% of the deaths attributed to COVID. So I think that's quite a lot.
It is. It is an impact. It is real big impact. And this is wonderful. This is really good that they did this, that they come up with the data. It certainly would have been nice to have that type of information before you start the vaccination program, right? It would have given a lot of reassurance, but you always come with the good news only after the pandemic. What can you do? I mean, this is life, right? You can only come up with the data.
Really, that's what we know about vaccines in general, right? When introduce vaccines, whether it's COVID or HPV or something else, you have all these good reassurance data reassuring you of the value of the vaccines only after several years of using it.
Yeah. And actually, the devastating thing for vaccines is even this information is from an observational study, so it cannot go into the label. It will never appear in the package insert. Mm-hmm. What will appear in the package insert is myocarditis, pericarditis, and HIT, the thrombotic events, right? That will appear because it's safety information, even if it comes from observational study. Whereas all positive information is left out. There is a bias in the label. That's what I want to highlight here, right?
Yes. And that's good that you mentioned that, Professor, because I think this is something that we, as even physicians and scientists, we are not aware of this, or we know it, but it's really not sort of something that's known through all the medical scientific world. But what you said is really true, that when it comes to safety, everything goes to the label.
Yeah, yeah. Very good. Now, I have an update on bird flu, influenza A H5N1 in the United States, and the update is from about a week ago, August 2nd. 3 additional human cases of highly pathogenic avian influenza, HPAI, and that is influenza AH5 or bird flu, have been confirmed in the United States. These cases come from another poultry farm in Colorado, and all the 3 subjects had mild illness, and they were offered oseltamivir, which is used for treatment of influenza. The total number of cases to date now in the United States is then 13. There was an additional H5N1 case in the United States who had been reported in 2022. So in total, the United States by today has 14 cases of bird flu. Now, the CDC in the United States recommends to avoid unprotected exposure to sick or dead animals, to avoid unprotected exposure to animal feces, bedding, litter, unpasteurized milk, or any material that has been in contact with animals that were suspected of having H5N1 virus. They also give recommendations for prevention, monitoring, and public health investigations. And this you can all read on the website of CDC, which is listed at the bottom of the slide. And I guess a very important piece of information is, at this point, there is no regular human-to-human transmission of the bird flu virus. So there is no need to panic, but one should be prepared. Melvin, any views from your side on the bird flu?
I think we don't want to make this the next COVID, right? We have just lived through the COVID pandemic, which is now, 5 years since 2019? And I think we have learned some lessons, but looking at what's happening with this bird flu, I think there are also still things that we can improve, and especially with surveillance.
Yeah. Again, no need to panic, but we closely need to monitor what happens if seasonal influenza A virus is circulating later in autumn, as we expected, and then there may be a reassortance between human H3 and whatever and 2 and or H1N1 and this. Yeah. And this flu virus, and then we may have human-to-human transmission. So this is what we worry about, right? And this is why we bring it up again and again. I have a next piece, which is also from the New England Journal of Medicine, published today. And they start with saying that H5N1 is spreading in US cattle, and there is H5N6 and other bird flu viruses in Asia. And the viewpoint there of the authors Sinha et al. In the New England Journal of Medicine, they raise the question, how can it be that politicians refuse to learn lessons from the COVID pandemic? Now, I highly recommend you reading the paper and apply it to your country. Some items may apply to your country, some not. And basically what I did, I listed here 6 items. And you should ask yourself, in my country, is there stockpiling of immediate needs in case of a pandemic, masks, antibiotics, whatever? Are supply chains secured for medical equipment, for medical tools and interventions? Is there appropriate surveillance available? Have people learned how to calculate real incidence data and not just report case numbers, which is stupid? Do we have vaccine production available? Are there any plans for procurement of vaccines? Is there appropriate communication to the lay public on hygiene measures and the benefits of vaccines and vaccination? Is there fiscal preparedness? Or is there political preparedness? And again, use this checklist, print it out, and tick the boxes. If you have 6 times, yes, your country is excellent. If you have 3 times, you are not ready yet. If you have 3 times or less, then you should work on it, right? This is just, again, from this paper that I read this morning, and I think it is a little bit of a guidance to the next pandemic in case it may come. Melvin, any views from your side?
I think this is a good checklist, Professor. It looks at what's happening in the US, what's happening in China, and as they say, when the US or China sneezes, the whole world actually gets sick, right?
Yeah, that is the story, right? I have one last piece, and that is again on COVID. And what we covered in the past was long COVID. Several times we spoke about it, how to define it. We had the definition, the latest definition from the US in our last session. Today we talk about a group of diseases called post-acute sequelae of COVID, PASC. So any disease that is caused by COVID infection, but is not part of the acute phase, but comes later on. That is called PASC. And I'll show you later on what that may be. It may be kidney disease, mental disease, lung disease, whatever. There are different diseases that result from COVID and that only come later on after you had the infection, a couple of weeks later. Now, what the authors of this study did is they looked at health records of Veterans Affairs hospitals in the United States. They built up a study population from the Veterans Affairs administrative system, and they had 440,000 veterans who had SARS coronavirus 2 infection between March 1st, 2020 and January 31st, 2022. They compared these SARS-infected veterans with 4.7 million non-infected contemporaneous controls. So you have a disease group and you have a non-infected group. And with the data they had, they estimated the cumulative incidence of post-acute sequelae of COVID at 1 year after SARS-CoV-2 infection during pre-Delta, Delta, and Omicron eras of the pandemic. So this is what they did. They looked at PASC incidences, and here is the data. In the unvaccinated pre-Delta, PASC was as frequent as 10%, 10%, 10 per 100 person. And then Delta came, and this dropped to, I would say, roughly 9 point or 8 point something. And then came the Omicron era, and this dropped again to, let's say, 7.5 or whatever it is. So you see there are significant differences in PASC in the unvaccinated subjects. And the learning is here, as the organism changes, it gets less virulent. It causes less post-acute diseases. In comparison to the unvaccinated, those who vaccinated, they certainly can only be established after the vaccine was available at about 1 year or a little bit more into the pandemic. That was the Delta era. And again, if you compare the PASC events per 100 person, this is roughly half. And you can see this down here from 9.5 to 5.3. And in the Omicron era, again, the vaccinated are protected. It's 50% less. It goes from 7 to 3.5 events per 100. So this again shows you the benefits of vaccination, not only to prevent severe COVID and deaths from COVID, but it also prevents post-acute sequelae. And I guess in the next slide, I have now details of the numbers if you're interested in that. And here, I don't want to go into this, but what I want to mention is the diseases that happen after COVID. The PAS disease categories are cardiovascular events. And that is what was just mentioned by Melvin. This is stroke and myocardial infarction. It was coagulation disorders, fatigue, and that is certainly post-COVID, gastrointestinal diseases, kidney diseases, mental health, and again, post-COVID, metabolic diseases, musculoskeletal weakness, post-COVID, neurologic and pulmonary, partially probably post-COVID, and then any PASC event is listed down here. So you see, COVID infection affects not only the lungs and the respiratory system, but it affects all organs of the human body. And the consequences are not limited to the acute phase of the disease, let's say 2 to 4 weeks into the disease, but they occur even very many weeks and months after the infection. Melvin, any comments, views?
Professor, can you show the previous slide again?
Here we go.
I think this is really important because we have been talking about this when the COVID pandemic was still in our daily conversations, right? We were asking whether the virus, is it going to be less virulent, less dangerous, less deadly, less whatever you have as time goes by. And we were saying that, yes, theoretically that could happen, but we don't have data. Now we have data.
Yeah. Yeah. Sometimes things are predictable, but it's difficult to prove. And again, you can
Yes.
prove things only after you did the experiment, or here it was an experiment of nature, so it couldn't be done, right? You cannot have the data before the pandemic, and you couldn't have the data before you came up with a vaccine, right? So you have to wait, and all the benefits now emerge, and it gives you the full picture of the benefits of vaccination. And actually, if I had the time, maybe somebody should write a paper on the benefits of COVID-19 vaccination beyond preventing death and disease, right? That would be a nice paper, but no time to do that. But maybe, Melvin, you find someone who has a little bit more time to work on that. Very good. So let's summarize. Melvin covered monkeypox cases spiking in 10 African countries, high death toll up to 6%. This is really an important issue, and it needs to be addressed by international public health authorities. He spoke about the hypervirulent multidrug-resistant Klebsiella causing outbreaks, not only in intensive care and hospitals, but also in the community out there. He spoke about the risk of heart attack and stroke reduced by COVID vaccination. Very important part, and it really has an impact shown in the United Kingdom. I gave you an H5N1 update. The total number of recent cases is now 13. The total number is 14 in the United States. No human-to-human transmission yet. I gave you, based on an article in the New England Journal of Medicine from today, a checklist if your country is prepared for a next influenza pandemic or any pandemic. And then we covered post-acute sequelae of COVID, and we showed you that vaccinated subjects had a 50% reduction of the risk to come down with any organ disease that is caused by COVID as compared to unvaccinated subjects. Melvin, that was it, but you have a nice cartoon in the end.
Yes. So I think this is just a reminder for us that, right, that we need to show up if we want the opportunities to come our way, because if we are not there, if we're not engaging people, opportunities will not come to us. So I think this is pretty clear.
Yeah. Thank you for this. A clinical saying used to be, if you don't take the temperature, you won't find a fever, right? So yes. not measuring or not being active doesn't tell you what is really going on. Thank you very much, Melvin. Goodbye, and hope to meet you again next week. Bye-bye.
Thank you, everyone. Stay safe.